Okay, nice to meet you, Mr. Roach. My name's Dr. Ahmed. I'm one of the doctors here today. I'd like to start by asking you some questions, if that's all right. Can you tell me what's brought you to the clinic today?
What brought me to the clinic today is excessive water in my stomach and also on my leg, which is swollen.
Okay. When did these problems start?
While I was on holiday, I'd say a fortnight into my holiday, coming home after that. So roughly all about a month.
Where did you go on holiday?
I went to Turkey.
Did you develop your problems whilst you were in Turkey?
Just the leg kept swelling up and I had to put it up on about 5 pillars, to reduce the...
Was it just the one leg or both legs?
Well, it was the two actually.
And what did you first notice when you started noticing the swelling in your legs? When did your belly become swollen?
That was when I come home.
Okay.
That's when I had to go to my own GP and tell them what was going on.
Had you been unwell whilst you were in Turkey or when you got back?
I was fine when I was there. It was just when I got home that I felt unwell.
And what do you mean you felt unwell?
Well, I kept going to the toilet, I had diarrhea, and I was trying to vomit and I couldn't vomit, and I was just full of aches and pains.
Okay, so you're trying to vomit but you didn't vomit?
No.
But you had diarrhea?
Oh, I had loads of it.
Did you have much pain in your belly?
Yeah, I had loads of massive pains on it.
Okay. Was there any one spot that was more painful? And did the swelling develop suddenly or gradually?
It developed within about a week and it just come up real massive.
Okay. Did you notice any blood from your back passage when you went to the toilet or any black motion?
There was no blood.
Did you notice any fevers or sweats?
No.
Did you feel itchy or have any rashes?
Well, that was itching all the time.
Okay. And were you feeling tired at all?
Oh, very tired, yeah. I was going to sleep all the time.
Would you say that you felt unwell?
Yeah, I was unwell, yeah.
Okay. Can I ask a little bit more about your history in terms of when you were away in Turkey? Yeah. Did you have any tattoos done whilst you were abroad?
No.
Have you been abroad before to any exotic places?
Yeah. I was in that same place the year before.
And any problems when you went the year before?
No.
Do you smoke at all?
No.
Do you drink much in the way of alcohol?
No.
Have you ever drunk alcohol?
Oh, yeah. Really severe when I was younger.
Okay. And how much did you used to drink then? A lot or?
Till I conked out.
Okay. So it was fair to say you drank too much alcohol when you were younger. Yeah. And how long was that a problem for?
Quite a number of years.
When did you manage to stop?
15, 16 years ago now.
Are you on any regular medications?
A blood pressure tablet in the morning. I'm on of an evening. I'm on a quinine of a night. I'm on cholesterol of a night. I'm on a tablet for my stomach. Other tablet, a little pink one, that stops me taking strokes.
Okay, so you've got problems with your...
sometimes.
All right. So you've got problems with your blood pressure, cholesterol. Have you ever had a stroke in the past?
Believe it, and I had a mini stroke many years ago.
Okay. Are you diabetic at all?
I'm a diabetic now.
All right. And have you ever been told you've got problems with your liver?
Yeah, I've been told on a number of occasions I've had problems with my liver.
Okay. And has anybody mentioned whether that was through the drinking?
Yeah.
Thank you, Mr. Roach. I've finished asking you the questions now. So what I'd like to do now is examine you, if that's all right.
No problem.
Okay. Mr. Roach, what I'd like to start by doing is examining your hands. And turn your hands over. And the other one, please. All right. Can you pop your wrists out for me? Cock your hands back and leave them like that. That's it. Okay, thank you. That's lovely. Look up for me. And look down. That's lovely. And have a look at your face. Okay, and a look at your chest. Okay, I'm just going to lie you flat. Okay, let me know if it's uncomfortable for you. Is that okay? All right. Just going to have a feel of your belly. Let me know if you've got any pain anywhere. That's okay. Okay. Can I ask you to breathe in and out, and again, and out. Once more, and out, and again, and out. That's lovely. Just going to tap on your chest and your belly. Let me know if it's painful. I'm just going to press on your belly again. Breathe in and out, and again, and out. Once more, and out, and again, and out, and again, and once more, and out. It's lovely.
Okay, you have 2 minutes remaining.
Sorry, is that painful?
No.
All right. Just going to tap on your belly again. Just roll on your side towards me. That's great. Okay, thank you. And roll back. That's lovely. I'll cover you up. I'm just going to examine your legs. Let me know if it hurts when I press on. Is that painful at all? No. Okay, we've finished. Okay, Mr. Roach, now that I've finished asking you questions and examining you, I think the problem is that you've got a build-up of fluid in the abdomen, something called ascites, and you've also got some fluid on your legs. Okay, that's something that we can treat quite easily. We can give you some water tablets in the first instance, but I'd like to undertake some further investigations, take some special blood tests, check your blood count, check the clotting of your liver, and also get a scan of your belly, see how much fluid's there and what your liver's able to do. Okay. Is there anything you'd like to ask me before we do those investigations?
I would just stop the build-up of the water.
Well, we can give you water tablets, special water tablets to help you to get rid of some of the fluid that's on your legs and on your belly, and then we'll take it from there. Okay?
Okay, thanks.
All right, thank you.
Thank you.
What is your diagnosis for this patient?
This patient clearly had evidence of ascites, as evidenced by his marked abdominal distension with evidence of shifting dullness. He also had evidence of marked bilateral pitting pedal edema when we examined his legs. The causes, the most likely cause for his ascites is cirrhosis of the liver secondary to alcohol excess previously. However, his recent travel to Turkey would be significant, as he may well have had a viral illness or contracted another cause of hepatitis that pushed him into decompensated liver failure.
And how would you treat ascites?
The mainstay of treatment for ascites consists of diuretic therapy, in the main spironolactone and furosemide, which can be given in quite high doses. Other treatments involve drainage of ascites with an acidic drain, with or without the replacement of albumin. Nutritional supplements are important so that the patient increases the amount of protein and albumin in their blood. When examining a patient with ascites, it's not only important to ask about alcohol intake and an alcohol history, but also to ask about other external factors such as travel, tattoos, viral illnesses, blood transfusions and family history, to exclude things like hemochromatosis and Wilson's disease also. If this was a female patient, then it'd also be salient to ask about her menstrual history, postmenopausal bleeding, and recommend performing a pelvic ultrasound scan to exclude ovarian causes of ascites.